I'm talking on behalf of DermaVidya, Access to Dermatology World. Today we'll be discussing about causes of hair fall and the role of oral supplementation. Your hair as an organ system is a really dynamic structure which is sensitive to a lot of things, including your diet, to your lifestyle, your stress. Every little thing that's changing in your body can affect your hair positively and negatively. Let's go over some of the causes for hair loss. One of the main reasons can be genetic factors, wherein you could be genetically having thin hair, or your individual hair can be thin in diameter, so your overall hair density can be low compared to some. The next on the list is androgenic hormones. The hair loss caused by androgenic hormones is known as androgenetic alopecia, which can affect both males and females. It can be called as male pattern or female pattern hair loss. Next cause can be telogen effluvium, or hair loss that happens post childbirth, post any major illness like typhoid, malaria, post surgery or any crash dieting or even a bone fracture. Next on the list is hair loss caused by a few medications. Some medications can have a side effect like hair fall. For example, antidepressants, anti-acne medicine which is isotretinoin, systemic steroids and some anti-epileptic medicines can lead to hair fall. Even chemotherapy can lead to hair fall. Next on the list is your thyroid disorders. Most commonly, hypothyroidism can lead to hair fall. So it's very important that you see your dermatologist and get evaluated for your thyroid levels to understand if your hair fall is because of your thyroid issues. Next, we have hair fall because of nutritional deficiency. Most commonly, we have iron deficiency anemia, which is again very rampant in India, in Indian women and girls especially. Then we have vitamin D deficiency and zinc deficiency. It's very essential to address the nutritional deficiencies when it comes to hair fall that is happening secondary to this reason, because otherwise if you're doing other remedies or other treatment modalities in this case and not treating the nutritional deficiency, you're not going to get the results. Next is hair fall secondary to some scalp disorders like dandruff or psoriasis. There can be many, but dandruff is a very common condition of the scalp. That's why I'm mentioning here. So believe it or not, even if you have dandruff, it can lead to hair fall. So it's important that you cleanse your scalp well, keep your scalp clean, and you don't continue not treating your dandruff, because that's going to lead to hair fall. Next, we have alopecia areata, which is an autoimmune condition wherein for no reason your body is trying to attack your own hair cells and there is hair loss happening in circular patches. Next, we have traction alopecia, which means hair fall secondary to really tight hairstyles. When you pull your hair really tight, especially in high ponytails, girls can lose hair in this area, which is what is traction alopecia. So stick to really loose hairstyles. Last but not the least, we have the chemical hair straightening treatments as one of the causes of hair fall. All the treatments, whether it is chemical straightening, rebonding or keratin treatments, all of them involve a lot of chemicals that are really harsh for your hair, and it can lead to hair fall in the next 3 to 4 months. So stay away from getting any of these procedures done. Another major cause for hair loss can be stress. Any kind of stress, small or big, emotional stress can lead to severe hair loss. So you have to know how to manage your stress if you're trying to have hair for as long as you want. The most common hair fall cases that we see in the clinic are hair fall secondary to nutritional deficiencies, telogen effluvium, that is hair fall after childbirth or any major illness, and third is androgenetic alopecia. Although all of these causes are different, there can be a lot of overlap when it comes to treatment of these conditions. Now, When should you be concerned and when should you go and see a dermatologist? Anywhere from 50 to 100 hair strands hair fall per day is considered normal. If you feel like you're having severe hair fall wherein you can see that the number of hair can be roughly over 100 to 150 hair, then you should definitely go see your dermatologist. It's important to visit your dermatologist because they can understand what is the reason for your hair fall and treat you accordingly. Your dermatologist is going to examine your scalp, see for any scalp disorders if you have any. They're going to perform some tests in the clinic and understand what is the extent of your hair fall, and they can also write a few tests to know whether you have any nutritional deficiency. Once you know whether or not you have any nutritional deficiency, your dermatologist may prescribe you with certain medications like certain tablets for your vitamin D or B12 deficiency, and it's very important to take those as advised because only after that you can expect any amount of improvement in your hair fall and you can see some hair regrowth happening. Now these are the things that your dermatologist can do to help you with your hair fall. But what can you do for your hair to improve? When it comes to genetics, not much you can do. But you can definitely work on your sleep, your lifestyle and your diet. 8 hours of uninterrupted sleep every night is very essential for your hair to regrow and also for your hair fall to stop. When it comes to a good lifestyle, of course, limiting your junk food, limiting some habits like smoking and alcohol can really help your hair. When it comes to diet, it's very important to understand that we have to include proteins in our diet because as Indians, we are more carbohydrate lovers, including our breakfast, lunch and dinner is more carbohydrate predominant, but try to include some healthy proteins in your diet like egg whites. If you're a non-vegetarian, fish and chicken breast is great. Some nuts for the vitamins and minerals. This is really going to help your hair fall and your hair regrowth journey. I hope I've been able to give you an overview on insights of hair fall. And if you find the video helpful, do check out the video dermavidya.com for more such videos. Thank you.
For more such videos, visit or log into dermavidya.com.